Hey guys, it's Nurse Gwenny. Let's talk about diffuse axonal injury. DAI is a type of brain injury that we see in our patients with sudden acceleration, deceleration, or even rotational forces, like in car accidents, falls, or shaken baby syndrome. So it's important to understand that the brain isn't just a pile of electric baloney. It actually has tons of little fibers and microvasculature in there. And when we see a patient, we can see stretching or even breaking of those fibers, those long skinny nerve cells, and the microvasculature in the brain. So with these patients, their head CT might look totally normal. It's not going to be as overt as, say, an epidural or subdural hematoma. Now, sometimes in severe cases, we can see what's called punctate hemorrhages, little bitty polka dots on the head CT, but again, usually it's not that overt. And this is more of a clinical diagnosis where we're combining the mechanism. Is the patient having dysautonomia, meaning their brainstem is not functioning as it should be, and so their heart rate, their blood pressure, their respiratory rate are all out of whack. Now, you're probably not going to see Cushing's syndrome in the acute setting with these patients like we might with some of those brain injured patients, and that also means we're not going to reach for our normal therapies of doing hypertonic saline or mannitol to reduce the chances of that herniation. We don't see that in the acute setting of DAI where we're caring for our patients in our pre-hospital setting. If there's going to be brain edema, usually it's a couple of days later as this injury gets worse. So what are we going to do about it pre-hospital? Our primary goal is going to be to prevent secondary injury to the brain. So prevent hypoxia, avoid hyper or hypocarbia. So we don't want to over or under ventilate these patients. We want to control their blood pressure and keep it in a normal range. And also check that glucose because we certainly don't want these patients hyper or hypoglycemic. So there you have it. A little bit of information on diffuse axonal injury.